Nutrition after transplant. Always check with your doctor or the dietitian before changing your diet or starting any type of over the counter supplement. Be aware of your potassium, phosphorus, and magnesium blood levels, as you may need a special diet. Be aware of serving sizes. Include fiber rich foods, fresh fruits and vegetables, and foods low in fat. Use choosemyplate.gov as a sample of how your plate should look like. For grains and starches, you want to include 6 to 11 servings per day of whole grain bread, cereals, crackers, brown rice, or whole wheat pasta. If you are a smaller person, you may want to include 6 to 9 servings. For people who require more calories, you want to include 9 to 11 servings per day. You may also want to check with the doctor or dietitian to determine the right amount for you. A serving size would include a slice of bread, half a cup of cooked rice, or half a cup of cooked vegetable. Protein is needed for healing. At the beginning of your transplant, you will need 2 palms of your hand servings or more for your surgery site to heal. As your surgery site heals, you do not need a large protein intake. Protein-rich foods includes lean red meat, chicken without skin, fish, and eggs. Be sure to ask your dietitian about including plant-based proteins such as tofu, beans, nuts, and seeds. For milk and dairy, you want to include 1 to 2 servings of dairy a day. You may also want to consider including almond milk, oat milk, or rice milk as alternatives. You always want to make sure you choose low-fat or fat-free dairy products. You want to include 5 to 9 servings of fresh fruit and vegetables per day. A serving size includes a medium-sized fruit or half a cup of canned fruit, or a cup of raw leafy vegetables. You want to limit fruit juice to half a cup per day. For fat, you want to choose heart-healthy fats found in monounsaturated and polyunsaturated fats. These fats are fish, nuts, vegetable oils, olive oil, canola, corn, sunflower, and vegetable oil. You want to include less saturated fats, as is butter, shortening, and lard. For fluid, you want to keep your new kidney well hydrated. You want to include 2 cups more of what you urinate out. The general recommendation is 2 to 3 liters per day, but the doctor or nurse practitioner can give you a specific amount that's right for you. What's not recommended is coconut water, sports drinks, and energy drinks. A low salt diet is helpful if you have high blood pressure or low urine output or even fluid retention. However, if you need to drink 2 liters of fluid or more, it is important to add some salt in your diet to prevent low blood sodium levels. But check with your doctor or dietitian about your sodium needs. For food safety, you want to make sure your meat is fully cooked. You are able to include fresh fruit and vegetables as long as it's rinsed and washed well. Keep hot foods hot and cold foods cold. When using a knife and cutting board and preparing raw meat, make sure to wash it well before reusing it to cut fresh fruits and vegetables. Be mindful of use by and sell by dates. When in doubt, throw it out. Here is a list of USDA recommended safe cooking temperatures for meats. For beef, pork, veal, lamb, steaks, roast, 145 degrees, fish, 145, ground beef, 160, egg dishes, 160, for turkey, chicken, duck, 165 degrees Fahrenheit. Foods to avoid. You want to avoid grapefruit and pomegranate as it can interfere with your transplant medications. You want to avoid herbal supplements such as St. John's wort ginseng, as these supplements were not studied in transplant patients and can interfere with your medications. Be sure to discuss any type of nutrition supplement with the doctor or dietitian before using them. It's important to maintain an active lifestyle. An active lifestyle improves your health by managing your weight. You want to add activities that you enjoy. And you always want to check with the doctor to make sure whatever exercises you want to do is right for you. Here are some resources if you want to look at um, different topics pertaining to nutrition. Also, to reach the transplant dietitian, feel free to call the transplant program at 714 456 8441. Thank you.